Welcome, doctors. Let's face it, HIPAA can feel like one of those overwhelming regulations that hangs over every corner of healthcare. You know it's important. But when it comes down to the day-to-day, especially in medical coding, it can feel like a maze of rules, exceptions, and legal jargon. If you're managing a practice, running a billing department, or outsourcing coding work, this message is for you. Because HIPAA compliance isn't just about checking a box. It's about safeguarding your patient's most private, sensitive information, and making sure your reputation remains intact. Now, first things first, what exactly is HIPAA, and why should medical coders care? HIPAA stands for the Health Insurance Portability and Accountability Act. In plain English, it's the law that tells us how to protect patient data, especially things like diagnosis codes, procedure notes, insurance details, and all those digital records that flow through your practice every day. As doctors, you already know that PHI, protected health information, needs to be handled with care. But here's the catch: medical coders deal with PHI constantly. Every CPT, ICD-10, and HCPCS code ties back to a real person's story. One misstep, a file sent to the wrong email, a screen left open in a shared office, and boom, you've got a HIPAA violation. Let's break down the core HIPAA rules every coding team must follow. The privacy rule is first. It means coders must only access what's necessary to do their job. No snooping, no sharing, and definitely no patient info on sticky notes or visible on open screens. Then comes the security rule, which ensures that electronic data is protected with secure passwords, encrypted tools, and properly managed storage. The minimum necessary rule says even if someone can access a patient's entire chart, they shouldn't, unless it's essential to the task. And let's not forget audit controls. Every single time PHI is accessed, there should be a clear digital trail showing who, when, and why. Lastly, if something goes wrong, and it can, there's the breach notification rule. That means you're legally obligated to inform the patient and potentially the Department of Health and Human Services. Now, what happens if HIPAA isn't followed? The consequences aren't small. Fines can go as high as $50,000 per violation. Patient trust can erode quickly. And it doesn't take something major to trigger it. Even saving a file on an unsecured personal laptop can cause major issues. Here's the good news: you don't have to handle all of this yourself. At Staffingly, Inc., we specialize in HIPAA-compliant medical coding. That means when you partner with us, you're not just hiring coders, you're hiring trained professionals who understand privacy laws, follow secure digital practices, and code accurately using the latest ICD-10, CAPTAIN, and HCPCS updates. We use secure platforms that track access and protect data from end to end. Our team undergoes ongoing training and internal audits to ensure everything stays sharp, updated, and compliant. We don't just meet HIPAA standards, we make them effortless for your practice. Whether you're running a solo clinic or overseeing a large provider group, our AI-powered, virtual coding solutions keep your operations accurate, compliant, and headache-free. So, doctors, if you're ready to reduce risk, protect patient data, and increase efficiency all at once, let's talk. Because when your coding is backed by Staffingly, you can stay focused on what really matters, delivering excellent care. Thank you for watching, and more importantly, thank you for always keeping your patient's trust at the heart of your practice.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.